My name is Thomas Lyles, and I am a gastroenterologist in Bedford, Texas. I'm originally from Alabama. That's where I grew up and did all of my education. And when I was in high school, I initially became interested in becoming a physician. My mom was a nurse, and I saw the positive impact she had on her patients in the community at the hospital and also in teaching nursing. And I realized that I also wanted to be involved in healthcare, and that led to my interest in becoming involved in healthcare and ultimately becoming a physician. I became interested in gastroenterology in particular during the first 2 years of medical school, when we learned just about basic functions of the body, including anatomy and physiology and cell biology. And I found it fascinating how important the gut was to our overall body, to see what we had been reading about in the textbooks in our hands and correlate that with what we had been seeing on our rotations and how that impacted patients. And from then, I knew that I wanted to be a gastroenterologist, and I was fortunate enough to be able to do an internal medicine residency at UT-Southwestern in Parkland, and then also to complete my gastroenterology fellowship at UT-Southwestern in Parkland. I can say most fortunate after that to be able to join DHAT here in Bedford, Texas, where I've been in practice since 2013. So one of the greatest things about being a physician is the patient-physician relationship, and it's something that I take very seriously and hold it in high regard. And so when I meet patients for the first time, I want them to feel relaxed and I want them to feel comfortable. After all, for what we do as gastroenterologists, we do talk about the guts and intestines and poop and farting and belching and things that you really don't normally talk to people about or really kind of want to talk to them about. And so I want patients to feel comfortable. I want them to feel like they can really tell me, hey, here's exactly what I'm feeling and experiencing, and how can you help me out? And so one of the ways that I do that is just making them feel comfortable. Try to get to know them on a little bit more of a personal level than just, well, tell me about your bowel movements. And so for me, that leads into one of the most rewarding aspects of my job is having that personal relationship with my patients. And I get the most satisfaction out of knowing that at the end of the day, at the end of an office visit or a procedure or a diagnostic study or a medication, that we're able to really help them and get them to be the best people that they want to be. My name is Thomas Lyles, and I really appreciate your time, and I've enjoyed getting to speak with you a little bit today.